Hello everyone, my name is Biko Gaiman and I will be providing a brief overview of my research proposal regarding the conceptions of mental health in the African migrant community in Australia. For starters, Australia is becoming a popular destination for African forced migrants. A statistic from the 2020 Australian Bureau found that out of 7.6 million migrants living in Australia, about 380,000 were from African countries. Australia is regarded as a nation with a sprinting economy and a viable quality of life. However, refugees are still burdened by a variety of mental instabilities stemming from trauma, difficulties in social adaptation and adjustment to new systems, unemployment, and challenges assessing housing and education. As a result of constant comparisons from the media between good refugees and bad refugees, there has been a major gap in the refugee experience. People who arrive by boat or cross the border on their own are perceived as bad in comparison to those who resettle through the UNHCR channel. This labeling can cause damage to the confidence of the forced migrant as they already face the social challenges of integration. Furthermore, African businesses are known to underperform in Western countries because of discrimination. In comparison to other groups, African migrant youths are more likely to be at a higher risk of suicide and have increased risks of self-harm behaviors because of the challenges to the social factors following resettlement. Moreover, these migrant and refugee youths are also at a risk of increased use of alcohol and other drugs. Furthermore, issues such as racism have always been a barrier in receiving mental health services. Additionally, cultural beliefs can be an obstacle that impedes treatment because some African cultures don't necessarily believe in mental health and are ashamed to receive treatment. Finally, financial ability is one of the key barriers in receiving services. The questions this study will aim to answer includes: how is mental health conceived by African migrants and what factors influences this? Are there policies in Australia designed to address mental health issues after resettlement? What are the barriers that impede African refugees from receiving intervention? Sampling. This research will include 200 ethnic African migrants from multiple African communities living in Australia. Teens and adults of all genders will be recruited for this study. Due to the major gaps in experiences, white South Africans will be excluded from the study. English-speaking participants will be widely recruited. However, on-site interpreters will be available for the research to ensure that language is not a barrier. The research will be conducted in 2 phases. The first phase will include surveys and questionnaires, and the second phase will consist of group family interviews. This will allow researchers to gather a sufficient amount of information to propose adequate solutions. This research will employ a mixed method qualitative design. Methodology. This research will employ a mixed method qualitative design. First, a team of researchers will be assembled and recruited directly from the African communities for this study. This will ensure comfortability, trust, and transparency. Researchers will be trained on the different research methods to ensure the researchers collect accurate data. Next, a snowball sampling strategy will be utilized to recruit participants. Leaflets describing the study will be distributed and displayed in public spaces of the densely populated African migrant communities. Previous studies have highlighted the usefulness in snowball sampling due to its networking characteristics and flexibility. Snowball sampling has become popular in its means of recruiting research participants when seeking hard-to-reach populations. Such populations may potentially have low numbers, be geographically dispersed, feel stigmatized, and be particularly vulnerable, which will require a degree of trust in order to become willing participants. The main source of collecting data will come from the surveys and questionnaires. The questionnaire will consist of questions pertaining to demographics, socioeconomic status, migrant status, number of children, health equity, and support services. The surveys will contain questions pertaining to perceptions of mental health, racism and discrimination, policy, social support, family dynamics, and different forms of trauma during pre-settlement and post-settlement experiences. Finally, 5-week family group interviews will be conducted to capture the different aspects of lived experiences and family function. These will be held at the participant's home or private location to prevent distraction and ensure comfortability to disclose information about mental health. Researchers will then analyze the findings to provide insight on these experiences and offer suggestions on how to improve these migrants' mental health outcomes. Ethical considerations. This research will champion the do not harm principle and ensure that no harm is done to the physical, mental, and emotional states of each participant in the study. If there are any instances of harm during the process of gathering information, the study will be discontinued until all issues are mitigated. All questions will be reviewed by community members and will be adjusted in a way that promotes privacy, autonomy, and comfortability. In this way, the participants have full control and input in the way the data is presented. Partnerships with local advocacy groups will be established to ensure methods of self-care are being carried out because of the sensitivity of the topic of mental health. Moreover, the voices of the participants will be amplified in a way that best suits them. In terms of informed consent, all participants must voluntarily and formally consent to participate in the research after being informed about all the potential risks and benefits of their participation. Participants will also understand their right to refuse participation at any stage in the research process. Respondents will ensure participants don't feel the pressure to participate for financial reasons. To respect the participants' right to privacy and confidentiality, participants will be asked to sign a confidentiality agreement. Furthermore, the research team will avoid collecting potentially incriminating data and only collect data relevant to the research topic. All information will be fully anonymized. Additionally, researchers will take extra care to encrypt and securely store data and give subjects an opportunity to request destruction of audio-visual materials at any point. Finally, co-ownership will be promoted and each partner's contribution will be respectfully acknowledged. Expected outcomes. Some of the benefits that the research will provide include shedding light on how policies can be improved and how systems can be altered to address the needs of migrants. Additionally, the research will analyze the factors that impede migrants from receiving mental health services. Furthermore, this information is relevant in today's world because it will help us better understand the conditions that drive negative mental health. Overall, the data uncovered will provide a basis for future implementation that can improve mental well-being. Based on this data, researchers will determine what areas need services the most and what type of services need more focus. This can ensure that the implementations are being used and they are indeed effective. Thank you for listening and have a wonderful day.